Starting again. So advanced care planning in lung disease. So even if you're at the very beginning stages of a lung disease, it is considered a life-limiting illness, and it's wise to begin advanced care planning as soon as you're diagnosed. So what is an advanced care plan? Simply, it's a plan you make in order to have your goals and wishes followed during your disease and especially at the end of your life. And it's important to know that your plan can be changed throughout the course of your disease. So once you put something in writing, it doesn't mean that it can't be changed, which is why it's good to start early, because as your disease progresses, you can change it according to your changing goals and wishes. So a plan is important regardless of whether you are incapacitated at the end of your life or not. And we'll get into a little bit of reasons as why that is. So there's a few steps, and the very first step is just to kind of figure out what your goals are. And the way we do that in my program is we have a serious illness conversation. So it's a guided conversation that you have with a healthcare professional and with your family members. And it helps all of us to understand your goals, values, and also your anxieties surrounding your disease and also the end of your life. The next step, or a step in line with this, is a MOST, which stands for a medical order for scope of treatment form. And we're going to go over each of these individually. And then obviously there's some supporting documentation that we have to do as well. So number one, the serious illness conversation. You've been diagnosed with a serious illness like COPD, for example. The very first thing you need to do is have this conversation first with yourself and then with those around you and involved in your care. So not all healthcare professionals are trained in having this serious illness conversation, but all of us really want to know the answers to these questions. So there's 6 questions, and we'll just kind of go through them briefly so you understand what sorts of questions you need to be asking yourself. So number 1, what are your most important goals if your health situation worsens? So if you, for example, start deteriorating, what are things that are very important to you? Those are questions only you can answer. And then we need to explore your fears a little bit. What are your biggest fears and worries about the future with your health? And then what gives you strength to, as you think about the future with your illness? What sorts of things help you cope? Who do you rely on, and things like that? The next questions get a little bit more specific. It says, what abilities are so critical to your life that you can't imagine living without them? So for example, is this walking, eating, speaking? You need to think about what abilities are so critical that you can't imagine living without them. If you become sicker, how much are you willing to go through for the possibility of gaining more time? And then also the very last question, which is very important in this context, is how much does your family know about your priorities and wishes? So if you think about these 6 questions, you also need to let your family know and your healthcare providers know. They're very in-depth questions. Obviously, sometimes there are things we don't necessarily want to think about, but the earlier you start thinking about them, the easier it is to let everybody in your care team know your wishes about them. If there's any questions about that serious illness for me or conversation, you can chime in. It's the very first step though, first with yourself, then with your family, and then with your healthcare providers. Then we're going to move on to the MOST form. So in BC, we communicate throughout the health authority the goals of care with a document that's called a MOST, and it stands for Medical Orders for Scope of Treatment. So this is a form that lets every healthcare worker who has access to your medical records know how much treatment you want. What is the scope of your treatment? So you fill this document out with your physician, and it's in harmony with your wishes, but also with a realistic view of your prognosis. Your physician can make recommendations about what most status they think you would be best in. So we'll go over the most a little bit here. So be informed about the pathways you can take during your illness in your most form. So the first approach is called a critical care approach. If you don't have a most form, you will be given a C2 in the hospital. So that is all critical care interventions. Everything we can possibly do to keep you alive, you will be given. So the next one down, you can choose as a critical care 1, which is we give all critical care interventions except CPR and defibrillation. So if your heart stops, we will not start it again. But if your lungs are in trouble, we will support them. So it includes intubation and ventilation, which is called life support. Critical care intervention 0 excludes CPR, defibrillation, and intubation. So C0 most does include intensive care though. So it can include drugs to support your blood pressure, to take care of critical illnesses that don't include your heart or your lungs. And again, at the end or partway through, if you have questions about these, just let me know. The next approach on the most form is a medical care approach. So a medical care approach is exactly what it sounds like. It's medical management. So the medical level 3 is medical management directed at curing or controlling symptoms of illness. So when you have an illness that can't be cured, we can cure the symptoms of that illness with medicine. So for example, if you were to get a really bad lung infection, we would give you antibiotics. Anything that would control a symptom of your illness, we would treat. Medical level 2 is a symptom control with possible transport to hospital if needed for symptom management, but not for diagnostics. So if you have a symptom, we will treat that symptom, but we may not try and diagnose what's causing that symptom. And the purpose of this is basically to keep you out of the hospital so that we can manage you in your preferred location. Medical management 1 is just symptom control with medication only. So you will not go to the hospital. Care happens at home or at hospice. So that's the most form, just the scope of treatment, the main portion of the form. But there are other parts of the form at the bottom that are interventions that some people may accept or decline, regardless of their most status plan. And those are specific interventions. For example, you may choose to accept or decline blood products, accept or decline nutritional support, so that's a feeding tube, accept or decline dialysis, and accept or decline non-invasive ventilation or BiPAP. So you would just click which ones you've decided you would like to accept or decline. The next part of the form is the supporting documentation, and this is what we're going to talk about a little bit next. So the representation agreement that you have, we're hoping that you all end up with section 9s after this presentation. And then advanced directives we can talk about a little bit. Hopefully when you have a section 9, you have a most form and you've communicated with your family, you may not need an advanced directive. So the supporting documentation portion. These are the 3 documents you need to be fully planned. You need a representation 9 agreement, an enduring power of attorney form, and a will. So we'll start with the representative 9 agreement. So to make these documents, you have to be mentally capable. That's why it's important also to get these documents finished early. This way, the representative 9 and the enduring power of attorney are used when you're alive if you lose capacity to understand or make decisions. and a will is used after your death and will not affect healthcare while you are alive. So this is the types of planning as an overview. We're not going to talk about estate planning and wills. Those are for your personal planning in a different way. We're talking about personal planning while you are alive. So two types, legal and financial, which is taken care of by an enduring power of attorney, and then health and personal, which is taken care of by a representative agreement, Section 9. So we're talking about these two. We'll talk a little bit about this one, but we're hoping nobody needs this one. So first, Representative 9 agreement. So this is a representation agreement that gives your representative the authority to make very significant medical and other decisions for you, including the decision to refuse life-supporting treatment. Things you can authorize your representative to do on your behalf in this agreement include the ability to physically restrain or move you when necessary, despite your objections at the relevant time, give consent to specific kinds of health care in the circumstances outlined in your agreement, even if you are refusing to give your consent at the time. And they can refuse life-supporting care or treatment and refuse or give consent to other kinds of health care, but they cannot request MAID for you. And they can also admit you to a nursing home or any other kind of care facility. It's important to remember that this Rep 9 agreement is when you are considered incapable of making your own decisions. It's not that you fill it out and then the person can make these decisions for you tomorrow. It's good to remember. So the enduring power of attorney, it authorizes your appointed person to make decisions on your behalf and to do anything with respect to your financial, business, and legal affairs that you can lawfully do while you're mentally capable. So if you have the Rep 9, it takes care of all healthcare decisions. And if you have your enduring power of attorney, it takes care of your legal, business, and financial affairs. So Section 7, I said we weren't going to spend much time on it because we hope nobody will need to do it. But basically, if you delay making your Rep 9 and enduring power of attorney and are suddenly somehow incapable, you'll have a Rep 7 made for you. And so a Rep 7 is basically, it gives a person the ability to make healthcare and financial decisions for you. They can, for example, pay your bills, receive and deposit your pension or other income, purchase food and accommodation, make decisions about your personal care, minor health care, and major health care. But because you are not capable when you make this decision, those people, the person appointed, will not be able to refuse life-supporting care or treatment and make other big healthcare decisions that need to be authorized under a Section 9 agreement. So basically, it comes down to the fact that if you become incapacitated during your disease, someone will represent you. So it's best if you choose the person and communicate very thoroughly with them what your decisions are. If you end up with a Rep 7 agreement, it's possible that your goals won't be the person who is making the decisions for you may not understand your goals, and decisions may be made that you wouldn't be in agreement with were you capable. So let's all agree to not let it come to that. So how do you make these agreements? So it's very easy, and that's why hopefully today you can start the process. So a Representative 9 agreement, so that's the healthcare and personal matters, does not require you to consult a legal professional. You can very simply access the form online. So I'm gonna see if I can let this get shared as well. Can you see the website when it came up? No. So
are you sharing your desktop?
No, I'll just share my new screen.
Yeah.
So when I clicked on that website, nidus.ca, let me wait till it comes up. So this is just the website here. And basically all you do is you scroll down to I'm planning on the future. And you scroll down to, like it says here, you have to be considered mentally capable. And you scroll down and there's a basic representative 9 form right here that you can either fill out online, print out, and get done today. You need it to be witnessed, but it does not need to be notarized. And then that gives your appointed person the legal ability to make decisions for you should you become incapacitated. So very simple. There's quite a bit of extra information on the Rep 9 agreement on this website. So there's different ways for you to, for example, if we go, well, actually there's fact sheets that you can get that just basically explain what a person is allowed to do under the Representative 9 agreement. So if I click on this fact sheet, there's 9 pages of information explaining what your appointee will be authorized and not authorized to do. So I encourage you just to spend a little bit of time reading that over. And it has different sorts of situations that you might not have thought about that you can think about. It's a very, very good website just to get this representative form filled out and then appoint someone who you trust to just get that done when it happens. So I'm going to go back to my PowerPoint now and we'll see if it works again or if somehow I lost it.
Hi.
Hi.
Could I please get the name of the website?
Yes.
Thank you so much.
In the chat box.
I'm sorry, it's called.
It's www.nidus, NIDUS, NIDUS.
NIDUS.
Yep, .ca.
And then all you do is you scroll down to the part that says I'm planning on the future path. And then it'll have the Rep 9 agreement. It'll also have the enduring power of attorney agreement, but for that one, you do actually require it to be notarized. Yeah. So what they suggest is actually to not make your enduring power of attorney beforehand, make it with your notary.
Okay, very good. Perfect. Thank you so much.
No worries at all. So I just wanted to talk a little bit also about palliative care, just because there's a lot of misconceptions about palliative care benefits. And so just for your information, it says, in the estimated last 6 months of a person's life, the person will qualify for palliative care benefits. So these are government benefits that cover the extra cost associated with increased health care towards the end of a person's life. A person will only receive medical care, i.e. they must be a most level M1, M2, or M3 while under palliative care benefits, unless a critical care procedure will relieve suffering. So for example, if you were to break your arm and need surgery and you're palliative with medical treatment only, you would still get surgery that you need. A person who has palliative benefits and lives longer than 6 months will be reevaluated yearly by their physician to determine if they still qualify. Oh, it says my screen sharing is paused. Can you still all see this?
No.
Oh. What happened?
Are you able to unpause it, Ayla?
I don't know why it paused. Let me reshare.
Okay. We love technology. We all know.
Don't we? Is that good?
Yeah, we can see it. Can you click forward?
Yeah.
Perfect. Yeah, it's good.
Okay. So this point about how if a person lives longer than 6 months, they can be reevaluated yearly to still qualify for palliative benefits. It's just good for everybody to know that in studies, it's been shown that doctors and healthcare professionals are very bad at determining how long a person has left to live. We have tools that can give us an approximation, but generally it comes down to years, months, weeks. And we probably all know people who were given 6 months to live and 3 years later, they're still here. And that's just because we're just bad at determining how long a person has to live. That being said, palliative benefits are a wonderful provision from the government, and they really can give people extra support who need it as they're coming to the end of their lives. So it's very common for a person to re-qualify for palliative benefits many times over. So a common misunderstanding is that palliative care happens only in the last days to hours of life. That is not correct. Palliative care is an approach to care where a person, where the goal is to minimize suffering. The goal is quality of life over length of life. However, palliative care does not decrease length of life. In fact, it's been shown in studies that palliative care increases length of life by an average of 4 months if it's initiated early. And this just makes sense because if we improve quality of life, length of life often just follows. So a common situation may be that a person knows that their disease cannot be cured, and they may not want to undergo uncomfortable procedures that will not improve their quality of life. So that person may say to their physician, I would like a palliative care approach, and my goal is to live comfortably as long as possible. I think if we all thought about it, that would be all of our goals. So if someone brings up palliative care to you, don't immediately think to yourselves that that means that your life is over. That healthcare provider is trying to improve the quality of your life. So in conclusion, after you've had your serious illness conversation, after you've talked to your family, your doctor, your healthcare workers about the questions in that conversation, you've got your most form filled out with your doctor. These are the 3 forms that you need to get filled out and finished to be able to be fully covered, to have all of your goals and wishes met during your disease process. So you need your Rep 9 agreement. Remember, no lawyer is required, and the basic form online is free. It gives a person permission to make healthcare decisions for you if you need them to do so. Your enduring power of attorney is more for your financial decisions. And again, it's only if you are required to, the person, if you become incapacitated, that it'll go into effect. And then a will is used after your death. So that is the end of my PowerPoint presentation. Does anybody have any questions? It was a pretty quick, brief overview.